Hi guys, welcome back to my YouTube channel. Is it my YouTube channel? No. You're welcome to our channel. If you are new here, you're welcome. My name is Atoke. I'm a new mom. I'm a first-time mom, and this is our family channel. So in today's video, I'm just here to talk about my C-section, like my cesarean section. I gave birth through CS like 8 weeks ago, and I'm here to talk about the story. It's not going to be a vlog because the hospital where I put to bed, I wasn't allowed to film anything. In fact, it was so bad to the extent that the first time I went to check my baby at the ICU, the picture I snapped and the video I made, the nurse that was there collected the phone from me and deleted them with her hands. But thank God for recycle bin. I had to go to recycle bin to recycle like my baby's first picture in the ICU. Like, the hospital is that bad. You don't, at the front of each door is pasted there that you cannot record, you can't film, you can't snap, you can't video, you can't do anything. So I couldn't film my delivery at all. But I'm at Turkey. Like I said earlier, I'm a new mom. I'm a first-time mom. I'm a boy mom. If you are new here, you're welcome. This is our family channel. Stay back, relax, and listen because I have interesting things to talk about. So it all started on the 23rd of February this year. I went for my antenatal, that's my normal hospital appointment, and as at that time I was 37 weeks and 4 days pregnant. I made a video on what the challenges have been having before then. I'll put the link somewhere up here for you guys to see. If you've not seen that video, you should go and see it, then come back to the stories so that you can enjoy what I'm about to say and you can understand what I'm about to say rather. So at about 30 weeks I had preterm contraction. Then at about 33 weeks my BP was getting high, extremely high. Even till the day I went for my CS, my BP was still very high. When I got to know, when we found out, like when I went for my hospital appointment and I found out that my BP was high, the doctor already made me know that if it continues like that till I'm 37 weeks, that they were going to give me induction, like I was going to be induced, which I was cool with. But I was hoping it comes back to normal and stuff like that. So the last antenatal I went for before my CS was on a Wednesday, and as at that day I was 37 weeks and 4 days pregnant. So when I got there and I entered the consultation room where I was going to see the doctor, you know, in my hospital, I gave birth in a general hospital, so there are a lot of people. It's a very big hospital, and you when you get there first, you do your normal dancing exercise outside the doctor's office. They check your blood pressure, then you weigh yourself, you do your urine test before you go inside to see your doctor. So after doing that, my BP was still very high. I think as at that time I was like 174 over something, but the upper number was 174. So when I got to the doctor's room, he was like, go home, go bring your stuff, they're admitting you. My heart just did beep. I went with my mom. My mom had come like 5 days before then, so we went to the hospital together for the antenatal. Then I was like, really? The man said, yes, you're already 37 weeks and 4 days. The baby is mature enough. Let's just do this thing for the safety of, let's just admit you for the safety of the baby and the mom. As at then, the doctor was not even saying I was going to go through CS. He was just like, come and be admitted, so that even if it's going to be a vaginal birth, so you do the vaginal birth. If it's going to be CS, you do whatever it is going to be. So I went outside to tell my mom that they said I should go and bring my stuff. So, as at that time, I've not even packed my hospital bag. Like the things we bought to take to the hospital, I just kept them somewhere in the room. I didn't even pack them. It was that same day I did my, if you've seen my video where I talked about pack my hospital bag with me, I think that's like 2 videos before this one. It was that same day when I came back from the hospital at around 1 p.m. I was like, I want to do this video. It's in my mind to do it, even though my mind was worried. My heart was beating fast, like I was panicking. Because throughout this pregnancy, I've been scared. You know, scared of several things. Scared, fear of how is it going to be as a first-time mom. Fear of, and me, I can be so scared when it comes to hospital, syringe, blood, antenatal. It's just that I have to conceive and give birth because I'm a woman. If not, things like that scare me. So despite the fact that I was having panic in my mind, I still did that pack my hospital bag with me video. My mom was even waiting for me somewhere. I was like, let me quickly do this video. So I packed the hospital bag and I dropped it somewhere. My husband went to work. He was not even at home that day. I dropped it in the parlor for him to see. I put everything there so that when he comes, he doesn't need to search. He would not need to search for anything. He would just pick the bag and come meet us at the hospital. So I had called him earlier when I was leaving the hospital that see what the doctor said though. He even thought I was joking. I was like, this is serious. This is real life. This is reality. This is happening. We're having a baby. So I left with my mom. My mom picked like 2 clothes that she would be needing because she didn't even know whether she would sleep or she would not sleep over or whatever. She just picked like 2 clothes and then we went to the hospital. So that day was on a Wednesday. That was on the 23rd of February. So when we got to the hospital, they booked me in and they gave me bed, and they were like, that night of that Wednesday, they were going to do, I'll be induced and they will do cervical ripening. And before then, each time I go to antenatal, women that are giving birth before, that are not first time mom, anytime they talk about induction and cervical ripening and how it eventually failed and they had to do CS, all those stories used to scare me. In fact, the gist I heard, like 70% of people after induction, after the cervical ripening, they will still go through CS. And cervical ripening and induction is very, very painful. Now coupling that with going through CS is hard. And me, I have phobia for pain. So eventually, when I got back to the hospital, they said they were going to do the cervical ripening by 4 p.m. That was around it was around 2 p.m. or thereabouts. That 2 hours between 2 p.m. to 4 p.m. when they were to do the cervical ripening and induction was the scariest 2 hours of my life. I was feeling like 4 p.m. should not come. 4 p.m. should not come. When it was 4 p.m. and they came to the ward to call us, we were 8 in number that they were taking for the cervical ripening, where they were doing it. So the 8 of us, they changed us. They told us to change to our uniform. We wore our uniform, the hospital uniform. Then they matched us with our files. They matched us to where we were going to do the cervical ripening. On our way there, I made up my mind I was going to be the number 1. That when they say who is ready, I was going to stand up and say whatever it is I'll do it. Despite the fact that I had a lot of fear in my mind. When we got there, who is next? I didn't stand up till I was the last person. I shall notice that everybody that went inside, they will enter walking normal. They will come back walking like this. This is not me making fun of anything. This is me saying what I went through. Like, this is me saying how scared I was. This is not me making fun of anything. They will go inside walking normal. They will come out walking like this. This is not clear enough. Okay, they will come back walking like this. As in, very, very scary. I can't show it very well in the camera because of where I'm sitting down. But they will come back walking like, you know they are in pain. Pain, like whatever it is they went to do inside or they did to them inside is something very, very painful. And to worsen the whole situation, you know, in General Hospital, I mentioned how I found myself in General Hospital. I mentioned why I later registered in General Hospital in one of my videos that I did. I think I'll put the link in somewhere up here. Is when I talked about my preterm contraction, the high BP. It's not my preterm contraction in Jesus' name. When I talked about preterm contraction that I experienced, when I talked about IBP in that video, I mentioned why I eventually registered in January. Initially, I wasn't doing my antenatal in January, but towards the later part of the pregnancy, when I started noticing the preterm contraction, I had to go to General. And to worsen the situation, as I was saying before I chipped this into it, you know, it's not visiting hour. It's just you and God. They would not allow your husband or your mom or your loved ones, let's say, stay close to the door or probably stay beside you, where you will just come out and you cry on their shoulders. They are downstairs, far from you. They can't even come up. They will not allow them come and see you. It's just you finish that, you go back to your bed and lie down and be going through the labor pain, the everything, whatever comes after it, all by yourself till the next visiting hour when your partner or your loved ones will come, except there's an emergency or whatever that they need to call them. You get it? Was just me and God. So when it got to the number 7, I was like, will this really happen to me? Like, am I really going to allow them do this to me? I was contemplating. So after the seventh person left, I went inside. I just thank God for the doctor I met there, a very understanding doctor. Since I've been going to that hospital for antenatal, you know, sometimes they change your doctor. You might have like a group of people, because there are plenty pregnant women. If you've done your antenatal or if you've given birth in General Hospital before, you understand what I'm saying. There are plenty, so you can't keep seeing the same doctor. Even in a private hospital where there are few, they change the doctors. So it can be that a group of pregnant women is seeing these 4 doctors or these 3 doctors. You get, so of all the doctors I've been seeing when I was in antenatal, I have not met anyone as nice as nice as the one I met in that cervical ripening room, that induction room. So when I got there, I was the last person to enter. When I entered, he saw the fear in me. It was like I should relax. I was sweating. It was late at night too. There was fan, there was AC everywhere, but I was sweating. It was like I should relax, that everything would be all right. He's a young guy, that I should just relax and lie down on the bed. Then when I laid down on the bed, I opened my leg for the cervical ripening. You know the way you open your leg when you want to push now? I just checked under the bed. I saw cotton wool of blood they've done for people. That means I'll bleed. Whatever it is, or whatever it was going to be, I knew it was going to be painful. I started crying, shivering like this. I was shivering. I told the guy that my pain tolerance is very, very low. That can I do CS? Hey, I saw cervical ripening, I ran. And the cervical ripening kit, that thing that they will insert, you won't understand till you've seen that thing. That thing that they will insert inside. I said to them, doctor, is it this thing they will insert? He said yes. I was like, can I do CS? Like, can they allow me to CS? He said, why not? That I can do CS. That the only thing is that I'll have to write undertaking that I was the one that told him not to do the cervical ripening and the induction. I was like, I'll write it. He said, it's not a problem. That I said, can he allow me write it? Can he help me? Can he advocate for me and say that this person, because I was shivering, like I've never, I don't know how to say it. Like, I know I used to have fear of all those things, but that one was worse. Like, the bottom line, the deadline, it's either I do this, it was a do or die affair. It's either I do this or this baby keeps staying inside. It's either of the two. Baby's looking at me now and smiling. So Isha said no problem. I was in there for like 15 minutes. He was telling me to calm down, that everything will be okay, everything will be okay. I thought it was that easy to just pick CS in General Hospital. So when I came out at night, when I came out from the place, everybody was making fun of me. That's the people, the staff said, they were like, oh Johnny, oh Shekinikon. They took us back to the ward where we were. So when we got to the ward, people were doing, those that did the cervical ripening, they were having labor. Some people, like 2 persons, didn't even experience labor till like, they didn't experience labor at all. And these 2 persons, they were already above 40 weeks pregnant. So the 3rd day, that was the same day I did CS. After the cervical ripening didn't work on them. I did not know that a thing like that could happen. It didn't work on them. Labor didn't come even after the cervical ripening. So they had to go for CS. That's like 2 out of the 8 of us, apart from me, 7 that did the cervical ripening. 2 went for CS because the cervical ripening didn't work on them. In total, out of the 7 people that agreed to do cervical ripening, it was only 3 that gave birth through the natural delivery. The remaining 4 eventually did CS after the induction and after the cervical ripening. And that was my fear. That was what I did not want to go through with high blood pressure. So that was how Wednesday, the day I was admitted, was going to an end. Okay, so on Thursday, which was on the 24th of February, they already called the last doctor I saw when I was going for antenatal. That is the last person that attends to you before you put to bed. That will be your final doctor. That will be with you in the delivery room or probably in the CS room, whatever, in the theater. So they already called him that this your patient has refused induction and cervical ripening. We need your attention. So the man came very, very early that Thursday morning. When the man came, I've never seen in my life. The man refused that, as in he refused me doing CS. He said no, that I can push. I said, doctor, my BP is high. Apart from that, I'm very, very scared to push. I was so sincere with him. I said, I'm very, very scared to push, that I don't want to push after all the stress. I'll still end up going through CS, that I don't want to do. He said no, that I have to go for that induction and cervical ripening. It was not a small issue, that I have to go for it, that it can't allow me to do CS. Now it's my first baby, that it might be that if when I start with CS, I might end up going giving birth through CS. Although I understand him, but I just feel it's not something he's supposed to be adamant about. Like I feel that I have my choice to make. But you know, it's a general hospital and sometimes they can be like that. So the man was like, no, that I have to do the induction and the cervical ripening and try the delivery first. Then if it's not working, that's when they will now take me to the theater. I said no, that I want to do CS. They should just allow me that. They should see now, out of the 7 people that did this thing yesterday, early this morning they already took 2 to the theater. The remaining ones are to do the CS. The remaining ones are still there trying to you get. The man said no. That started around 8 a.m. on Thursday morning. We were on that. So when it was around 11, some nurses with higher grade, they went to see the man to talk to him. Some people came to intervene and all of that. People to go. They were pleading on my behalf. One woman was like, this lady has low pain tolerance. Let her, she's a nurse, like a matron, let her go for the CS. After all, she requested for it. The man was, and her BP is even high. Let her just do it. The man was like, my doctor was like, no, high BP doesn't mean that somebody cannot push, that I should still go for the vaginal delivery, the induction and the cervical ripening, and try the pushing first. Then anyhow it turns out fine, It's either I push, or like if the baby comes, fine. If the baby doesn't come, then they will now book me for theater. Several persons were against him, even his colleagues, but I don't know what I did to this man. And throughout my antenatal days, me and him did not have any problem. I don't know what I did to him. He was just bent on me not doing it. Shao, eventually, around 11 or 12 noon, thereabout, he now came. The doctor came and brought my file and said that I should write another undertaking and say that I was the one that picked it though. Picked that opted for CS, that whatever comes out of it, I should know that it's my fault. I said okay. I wrote another undertaking inside the put it in my file. So around like 1 p.m. 2 p.m. they already booked me for the CS. They already prepped me, like they've passed the cantata. They already passed cantata inside me. They already prepped me, passed all the syringe. So they were like, let them check my my glucose level, and they found out that my glucose level was very, very low. So they gave me glucose for like 2 hours. So let's say around 3 p.m. I was supposed to go into the theater. This my doctor just came from nowhere again and said that no, that me this night I have to try the cervical. I don't know what is happening. I have to try the cervical apnea and the induction again. That they can't teach him his job. That I can push. Why would I say I want to do CS? And really, till birth, my baby was just 2.8 kg. Baby was small. I knew that. I knew I could push, but I was just scared. Like, the fear was all over me. I did not get myself. I was looking so worried and tattered as a pregnant person during that period. So Isha came back like that though. People were begging him. When I say people, I mean his colleagues. So he was like, no, they can't teach him his job. They should allow me try. And you know, they already passed cantata inside. You know, when you are going to the theater, they pass cantata, they prep you for the whatever. So I was already like that, getting ready to enter the theater when this man came. Around 4 p.m. That was how that day, I could not go to the theater again. That was on the 24th of February. With the cantata and the prep, the syringe, whatever, that they already passed into my vein. I stayed like that till night of that day. I was telling the nurses that they should come and remove this cantata and the syringe so that the next day they will put another one for me when I'm ready, when my doctor has signed that they should take me to the theater. So the nurse was like, no, that she will only remove the cantata, then I will stay like that with the syringe that people that want to go for CS, that they will pass on them the day they are going for the CS. Mine stayed since the day before. They left it like that in my vein, doing nothing. That was on the 24th of February. So on the 25th of February, I was still hoping for a miracle to happen, for God to help me enter this doctor's mind so that I will come and give them a go ahead that they should allow me, because that fear of pushing was much. But before then, on that 24th night, their director used to like move around like few nights, maybe like 2-3 nights in a week, because that was the only night he moved around throughout my stay in the hospital. So he used to move around with his entourage, with few persons, to check on patients, interact with them, interrogate them and all of that. So coincidentally, I was on the corridor with my husband, telling him that, in fact, I was crying. I put my head on his chest like this. I was crying when the man passed that night. The man was like, what's the problem? I explained to him that, sir, I have low pain tolerance, like low pain tolerance, and I'm so scared, and my BP is high, and my doctor is still insisting on me going to do cervical ripening and induction. And I told him that and do and push. And I told him that I want CS, and he's saying no. The man was like, is that what you want? I said yes. He just said I should not worry, that something was going to be done. So the following day, which was on the 25th of February, which happens to be my immediate big sister birthday, like immediate, like the person I'm following, her birthday, 25th of February, that my doctor came from his house with good mind. I think the director contacted him or something and said they should allow me. But you needed to see the look on his face. He was so angry with me. I don't know, maybe it's more than that. As in, I don't know. He was so angry with me, and he was not smiling with me at all. To the extent that when we even got to the theater, because they will follow you to the theater, even though they will not be the ones to do the operation, but they will be there. This man, that one, I'm going to talk about what I experienced inside that theater in my next video, because this video is going to be too long. This man, he was angry with me even till the point of surgery. He was still angry because I was just watch out for the next video to see what I experienced inside that theater. So Isha came on the 25th morning and gave them a go ahead. I was happy. Even the food that they were bringing, because that hospital they used to give us food, I was not really eating. I was sad before then. I was like, have you ever been in like a situation where you think is either this happens or nothing? I was like, is either they allow me to do this CS, or how will this baby come out? Because I was too scared to push. Has been it is well. So Isha came and gave them a go ahead and signed to be already wrote the undertaking that I was giving them a go ahead. Then he told my husband to come and sign the, when you want to do surgery, they will tell somebody to come and sign. My husband signed, and they were like, they were going to do it today. I was happy, even if I was one that put CS on myself. I was very, very happy. I just thank God. So eventually around 10 p.m. they wheeled me to the theater. But when we got to the entrance of the theater, I don't know if that's how they do it there. You will sit down first, relax your mind. They would not let you know that you are relaxing your mind, but you will sit down there first. You have to sit down at that entrance. You stand up from that thing they used to push you, and then you will sit down first and feel good. Except it's an emergency. So I sat down there for like 1 hour, and then at around 11, I was wheeled into the theater. Then in my next video, I'm going to talk about what I saw inside the theater, like how the operation went, how it was, and then after CS is when you will know that you did CS. Till then, if you've watched this video to this point, please subscribe. Please. Like, give this video a thumbs up, share my video, share my link. You don't know who might need them these gists. You can't tell. So just share this video as much as you can. Please subscribe to our channel, and don't just subscribe, please turn on the notification bell so you get notified each time we post a new video on this channel. Thanks for the support, the love, the everything so far. So till my next video, stay happy, stay blessed. I love you. I'll see you soon.